Body contouring in 2021. What does that involve? Okay. Now, contouring means you can take fat out or put fat in. So you could do both. The reality of it is, for most people, they're realizing that they need technology. Just like iPhone, the same thing is true for lipocontouring of some sort, okay? And that could be external, like cryolipolysis, or something internal, radiofrequency, like InMode. Obviously, there's a technology. In-office awake procedures. People don't go on my website for Jason Martin MD. They go on for body tight or for this kind of procedure and that kind of procedure. They seek me out for technologies, and that's what's different in this day and age. And lastly, combination procedures. We've been doing combination procedures since 08, 09, combining body contouring procedures with other things. And guess what a combination procedure is? You take fat out and you put it in. That's combination. Why BeautiFill? This device is a fat transferring device that also does body contouring. And by the way, with this nanometer laser, it does do some skin tightening. In my office, I started doing blepharoplasties in 07 or 08, and then I worked up to body contouring, and then I worked up to mini tummy tucks, and then facelifts, and now brow lifts, and brachioplasties, and everything. I can do almost any surgery that I do in the OR, I can do in the office with local anesthesia. The next thing we're going to do is preoperative markings. We're going to have the patient come in here now. How much weight did you lose?
105.
On her own. No gastric bypass, hard work.
Very hard.
Yeah. So she was left with a lot of problems, okay? When you have weight loss, especially when you have Caucasian skin of over 100 pounds, massive weight loss of 60 pounds or over, you're left with a lot of problems. So tell the areas that you had the problems.
My arms, my stomach is still not great.
Yeah.
My legs were horrific. Yeah.
So sometimes you can just take every parts of people's bodies and redo them all, but that costs what? Money, time. She's a normal patient, so we're breaking it up. We're doing the areas most important to her first and then kind of working our way down. Yeah. One of the things that happens with weight loss is deficiencies. And you can see she's beautiful, but she definitely has deficiencies in the nasolabial folds. She definitely has deficiencies in the cheeks too. The modiolus and these marionettes. How old are you?
52 yesterday.
Yeah, you look amazing. So she has all the problems with weight loss, but she has fortunate preservation of somewhat of a youthful appearance. Now, we're not going to do the abdomen because she's lost a lot of weight. She doesn't have a good reservoir there. She definitely has some fat out here. So she has loose skin and other problems in that area. We're going to address that later with a tummy tuck. This is key. You can do a tummy tuck after this. This right here is where the most of the fat is, right? But that's not what I'm treating. If you just take that out and leave all the other stuff, the patients aren't going to be happy. So you want to treat the entire flank. And to be honest with you, I really like to define the upper butt. You can do just as much contouring of the butt with liposculpting as you can with fat transfer. To be honest with you, if you did liposculpting here and fat transfer here, that's how you get these amazing results for BBLs, by staying in the upper third of the butt and avoiding all the danger areas below, okay? So what we're gonna do today is this subunit. I feel like Mr. Rogers repeating it over and over. This subunit, okay? Let's lower this down here. And we're going to define her butt to give her some sense of a butt. And when I circle these areas right through here, I'm really circling the area that I want to do most. Okay, you can be very elaborate with your markings, okay? But really what you want to know is your boundary, and you want to know the area of most concern. And that's how I do these concentric circles to the middle, okay? Just like that. So first we're going to start with nasolabial folds. We're doing it in layered fashion, okay? We'll do stab incisions about right here.
That sounds scary.
Yeah, that's what medical words. Medical words are never nice. Okay, we're also going to do here, which is the marionette line. Young people don't even know what marionettes are anymore. You know what a marionette is, yeah. Okay, same thing on this side. Here. Okay, and I'm only marking these just so you guys can see it. Normally, I would just do a couple dots. That's what we're doing. Now, yeah. Are you seeing the lips? Oh, chin, yeah. So the chin is a really good place to do, actually. And the fat works well here. This is not a commonplace, really easy. There are no major blood vessels or nerves through there, so you have kind of easy access on that. And then if we have some, we'll see. Back out a little bit real quick. We'll do the malar prominence, but if you look at her, I actually think her cheek definition is wonderful. The reason why she looks so good is her skeletal makeup, right? It's your skeleton, it's what you inherited. You have these really broad cheeks that work really well for you. So augmenting nose is not going to gain as much, but if you were going to do that, you would probably do in these kind of areas. Infraorbital nerve is right here, so you want to stay away from that, and you would do in this area. Same thing over here. Just like that. All right, thank you guys. We'll see you during the case. Okay, we're going to start now. So with tumescent fluid, it's a slow movement, a slow movement. There you go, Jim. Slow. The slower you go, the better off it is for the patient. They're going to feel a lot better. How are you feeling so far with this? Good. Now we're going to go across the midline. All right, so the next thing we're going to do is pass off the laser. The cool thing is it fits right in the end of this suction cannula. Works in a radial fashion. The energy emits out from the edge here in a circular fashion, warms up the water, and allows you to get all that fat that you want to use for re-injection. Okay? This is the laser coming in. This is all set up because I have an amazing team. This is the suction coming off, okay? All right, so we can hear the suction. Here. So you can hear that. We're going to start in the area that we injected first, okay? Now, the first thing with this laser is you don't want to go fast. You want the laser energy to be emitted and to work in the soft tissue. Okay, as you can see on this camera right here, we can see my fingers. We're working our way over to the right flank. How are you doing? She's doing pretty well. She doesn't really feel anything right now. Again, tumescent anesthesia makes this case. So Amy, what are you doing to prepare that fat since you're the one always doing it anyway?
Right.
Yeah.
So obviously I'm just attaching this new tubing. I have capped the vacuum side. This is the patient side. And I'm going to just invert it on the stand. I'm going to actually pick it up and turn it so you can really see here how much, there's still some waste that collects in the canister. You're never going to avoid that, but the really good fat is within the trap. So give that a second to kind of settle.
All right, so here you go. Now you can see how slow I'm injecting in this stuff, all right? We're just doing this kind of a basic level injection here. That's good. And this is really deep that we're going. I know I can go deep here. I know that.
Sorry.
That's okay. There you go, good. Now I'm gonna go a little more superficial. And again, this is a 1 cc syringe. I've only injected 0.2. Now I'm gonna start doing that fanning motion here. A little bit at a time. Again, there's delivery systems that you can put on these cannulas that make it even less amount, but I feel pretty comfortable about where I am here. Now I'm really superficial too. All right, so that was our procedure. We did everything. We talked, we learned, we marked. We put the patient in the room, we prepped her, we did tumescent. We did aspiration with laser energy and delivery, and then we did fat grafting. So I just want to reinforce, as a board-certified plastic surgeon that really does like this device, the main thing that take away from that procedure for me is that fat that I pulled out was really good fat. It was super easy to inject. It wasn't clunky and bad, right? So that's what's going to make this procedure work. Need to emphasize why this is better. Fat viability, ease of use. All these things in the long term will have benefits. But this is the future. This device represents the future.